It is often thought that headache is not common among kids. It's not the case. Many kids do have headache. In a rough estimate, about 3% of kids around 3 years of age develop headache, and by the age of adolescence, almost 15% of kids have headache. The good thing about headache is most of them are benign. What that means is they wouldn't pose a threat to both the parents and kids, but there are definite challenges for both kids and parents, and it's a real challenge for the doctor also to diagnose and treat at times. Like in adults, kids also complain of headache. It can be either one-sided or both-sided. It can be throbbing. It may be associated or may not be associated with aura. I'll tell you later what an aura is. And the children get relief after a good sleep. And there's a strong family history of headache. So these are the characteristics. And something to be noted at this point is parents come up with some more histories, and that is whenever a bright light is flashed at the child, it becomes cranky. Whenever there's a loud noise, children get cranky. These are few things what needs to be noted when a child has headache. The peculiar things about a headache in children is it is of a much shorter duration. One-sided is less common. What that means is it's a generalized headache. They can't differentiate whether it is one-sided or both-sided headaches. And the parental observation of a child getting irritated with the light and sound is very common. And headache without aura is more common in kids than in adults. And many a times it can be just manifested as aura and not as headache. Aura is a set of symptoms what you would see about 5 or 10 minutes before the onset of headache. Generally, it lasts for less than 60 seconds. You have distorted visual images, black spots, bright light flashing on your face, something like that happens, and there are visual field defects. So this is the aura is so peculiar. By the time a person has aura next time, he or she knows that they're going to have headaches. So that peculiar is that aura. Though headache is a very benign and a very simple thing, with a frequent headache and a severe headache, it can lead to some consequences, and that is a child stops going to school whenever he has the headache, and there is decreased scholastic performance, anxiety or a depressed mood, family disruption can happen, and many times it can lead to very high healthcare costs. Though headache is simple without any major cause, but there are other causes why headache happens. It can be a systemic infection or a local brain infection following a seizure or a trauma or a tumor or a toxin or an intracranial bleed. There are hundreds of reasons why it happens, but we need to know, apart from migraine and a simple headache, there are many reasons it can happen, but by far the most common is still a simple headache. Though headache is simple, we need to keep some real red flags, and that is a recent onset of headache in a child which is less than 3 years old, and headache which doesn't get better with sleep. In fact, it worsens to an extent which wakes the child up from its sleep, and change in an established pattern of sleep, and absence of any family history. These are few things which we need to keep in mind. If any of these ones are there, it needs deep investigation. Once we have identified what a headache is, we need to understand how we would manage. There are two methods, rather one is a non-pharmacologic and pharmacologic. Pharmacologic is basically a change in different set of principles of life which makes your life much easy without headache. First of all would be hydration. A child should have a minimum of 4 to 8 glasses of water. A child should be thoroughly hydrated before going to any kind of sport, while going to a hot sun, or whenever a physical exertion and there is a possibility of dehydration. Make sure your child has enough of water, electrolytes and glucose. Caffeine and related beverages should be avoided as much as possible. Diet. Adequate amount of a balanced diet of all the nutrition is as much as important as a medicine is. That helps a child getting recurrent headaches. And next thing is sleep. At least 8 to 9 hours of uninterrupted sleep is what your child demands. So there are some methods by which you can enhance the sleep pattern. First thing is, avoid any gadgets before they go to sleep. Avoid anything which excites the child before they go to sleep, and make sure they have had a full sumptuous meal before they go to sleep. The problem is more so with adolescents, where they have the habit of waking up late in the night, getting up early in the morning, watching late night movies, late night calls, video games, all that. I think that is something which you need to address. If a child has a tendency of headache, it's better you avoid any of that. And if there is any need be, when a child's mood is really depressed or has anxiety disorders, a proper counseling may be needed. A set of symptoms and a set of treatment is just not enough. You need to have a proper environment for a child not to have these repeated headaches. Pharmacologic management can also be done, but I think it's beyond the scope of this segment. I'll leave that to a different day. But the most important thing which I want to convey here is, headaches are not uncommon. Most of them are simple. They would just need simple medicines or no medicines if you handle it properly. A good balanced diet, hydration, sleep and a healthy environment is all that is needed to reduce headaches in your child. Thanks for listening.